Hey, Mary. Thank you for doing this with us today. So, to start off, what led you and your family back here to Sweetwater?
Well, my husband grew up here in Sweetwater. He had seen a job opportunity at the Sweetwater Fire Department, and his family was still here. And so we decided to move back because we were having kids, I guess, starting a new family. And so we saw that opportunity.
And how many kids do you have?
We have 3 girls, 4 years apart, all 3.
And what made you decide to come work at Rolling Plains?
I had been a nurse for 8 years before I came, and so this was the ideal place to start applying. So,
Well, we're definitely glad that you decided to come here. What was your path to nursing?
I have 23 years as an RN. I started out as general pediatrics and then moved to pediatric emergency room at Dallas Children's and then at Cook Children's. And then from there, I kind of got not bored of pediatrics, but wanted something different. And so changed up to cardiac, kind of like a PCU unit. And then we moved here, and then it ended up med-surg charge nurse, and then home health, and then, of course, now my current job.
And what is your current job?
My current job is that I am the Director of Infection Control and Employee Health. So as an employee health nurse, my job is to kind of see all the new employees that come through, making sure that they are vaccinated with what is needed to protect them from related to caring for patients. The other part of it is making sure that the employees that are out on the units and stuff are also cared for. So like the requirements of doing making sure you're vaccinated or have your immunity for measles, chickenpox, Hep B. Some of the other things is doing fit tests, N95 fit tests, making sure you have the right size when you're having to go into airborne isolation rooms. And also I need to be able to prevent exposures. Some of the ways we do that is I look at the needles, making sure we have safety needles, making sure, of course, we're compliant in our isolation stuff, and then also hand hygiene compliance, everything like that. So
you're the really fun one that people get to see in new hire days, right?
Yes, of course. My infection control side of it is that I make sure that we don't spread infections from one patient to another, and that we are also preventing infections and hospital-acquired infections. One of the ways we do that is I monitor, when we place a Foley catheter, which is something that we do to help people that need to urinate or we need to monitor their output. We want to make sure that we are doing everything possible so that we don't cause that infection. Surgeries, I've monitored post-op surgeries, making sure that they've had their compliance related to antibiotics prior to, and then also education afterwards, and that they don't get infections. And if they do, how can we prevent it for the next time within the community? I monitor kind of the labs and stuff that come through our hospital to see if there's an increase in, let's say, COVIDs or flus or STDs or tuberculosis or different stuff like that. And just kind of make sure we're doing everything we can as a hospital to prevent some of that stuff.
And in your role, it doesn't sound like you necessarily touch a lot of patients that come into the hospital, but you're touching a lot of the people that touch the patients that come into the hospital. So what does it mean to you to be serving the people that are serving the community that you live in?
I have pride in what I do. I want to make sure that as employees are protected and cared for properly, because they're kind of my patients since I'm no longer one that works in the departments. The other thing is just making sure that the hospital has a high standard of care for the patients, especially in the infection control side of everything.
Absolutely. Yeah, unfortunately, you have to deal with me most of the time, so that's a trouble in its own right. And now we get into the nasty time of March of 2020, and people remember that time. And of course, I'm talking about COVID, and people remember that time a lot of different ways. Can you let us know kind of how you remember that time of your life?
Personally, the first thing that happened, of course, it was end of February, March when everything started getting announced about COVID. And personally, one of the things was my daughter had gone to Greece for an unofficial school trip just for a vacation time. And at that time, they were shutting down some of the other countries, but because she wanted to go to Japan, but Japan was already shut down. So Greece was where she went. And on Wednesday, we had gotten a call. Well, we saw on the news that Trump said by Friday, U.S. borders were going to be shut down completely. And so on Wednesday was the day that the travel agency, everybody was panicking, trying to get my daughter and her group of people back into the States. And she ended up going to Germany, I think Paris, and then all the way to Washington, D.C.
Oh my goodness.
Before she ended up in Dallas. During that time, then we got a call from the school, from Roscoe, because like I said, everybody's panicking. We don't know anything about the disease. And my two younger and her all go to school together. And they called us and said that if she came back home, that our whole family would have to quarantine for the 14 days. So it was something of, okay, well, our girls still need to go to school. We still need to go to work. And so what do you do? Luckily, my mom lives in Dallas, and so we had to make a call, and my mom was willing to take off to be able to quarantine with her. Michaela didn't have COVID, but because she had traveled, that's the reason why they decided that. So it was kind of, she was upset, but she had to quarantine the 14 days there so we could still be able to go to work and still the girls could go to school. Another one was my mother-in-law. She had been fighting leukemia for years, and she had gone to MD Anderson for her last chemo. It was an experimental one because we were just trying whatever we could, and we couldn't get a hold of her on her last treatment, and she was down in Houston. And we had found out she ended up in ICU in MD Anderson. And that was like at the end of April when that happened. And so my husband and his dad went down to Houston, and of course, MD Anderson wouldn't let them in, which is understandable at that time, and of course, the type of patients they have. But when she was actively dying, they had tested her for COVID, and at that time, the COVID test would take a long time to come back. And so when she was actively dying, all they could do was sit in the other room and watch her die. So it was very heartbreaking on that, but my husband still talks about it to this day, but it's just what it was at that time. But my last personal experience was my husband at the end of the year, 2020, around Christmas time, had gotten COVID. And he tried to make it through Christmas Day and just got where he couldn't breathe and had a lot of trouble. So we went to the ER and he ended up in ICU, and I didn't realize how bad he was because we couldn't go in there. So we didn't know how bad he was until he would tell me later. Luckily, it was here at this hospital, RPMH, and so I knew he was in good hands, and I knew that the nurses and doctors were going to look after him, even though I couldn't, because of course, if he has COVID, I had COVID. But he made it through, but it took him about 2 weeks for him to get better and recover, and he didn't go back to work until end of February. But it's interesting is at that same time, we had one of our nurses that was also sick with COVID, and pretty much same things as what was going on with my husband. And it took him a lot longer, but when you know people within the hospital, if you worked with them for so long, you rally behind them and encourage them. And so when that nurse was able to finally get discharged, everybody made a long line to the exit door and cheered him on and stuff. So it was a good thing.
That was one of the coolest discharges I think I've ever seen.
Mm-hmm. It was. But of course, we lost some people. We had 2 nurses. They had already retired, but like I said, we're family, so we kind of know everybody. One of the nurses had worked the ER for a long time, and the other nurse, they were husband and wife, and the other nurse worked in ICU. Their names were Sharon and Doug Harden, and they ended up coming into the ER, and I think we transferred one or both out, not sure. But they ended up both dying within a day of each other, day or two, I think. So I know we've lost a lot of family members. We have one housekeeper that I think lost about 3 siblings. And it's interesting is that the Valdez family, they have aunts and cousins and stuff that all a small amount of them, but do work here within RPMH too. So that was definitely hard on them. And when we did lose one of our employees, current employees, Linda Vera, so there has been loss, and it was definitely hard on those nurses that had to care for ones that they know so, personally.
So you kind of were hit two different ways whenever COVID hit. And you went from, you were telling us your job description before, and it seems like when COVID hit, both of those positions were heightened to new levels with COVID, both on the employee side and the community side, with a deadly infectious disease coming into our community and employees having to do a lot of precautions to keep it out of our hospital. So could you tell us just a little bit about how your role changed, pretty much overnight?
It did. my job is to protect. My job is to make sure that employees are safe, patients are safe. We're doing exactly what we're supposed to do. It changed in the matter that all of a sudden I was more responsible and more, I guess, in active gear. Because, I'm always doing or looking at everything behind the scenes. But when COVID hit, it was going, okay, what do we got to do? How do we do it? How do we protect the people, the community? How do we protect the hospital? All of that.
When it seemed, I was in HR at the time, and it seemed like for us even that guidelines were changing almost every day. At least for the first couple of months, it seemed that we were having to go through guidelines quite often to make sure that we were up to the new guidelines. And I can only imagine it was the same for you.
Yeah, CDC was mainly what I followed at that time, at the very beginning, because they were the ones that were pretty much up to par as best as they could, because they were scrambling too. So we kind of looked at them to kind of say, okay, what else do we need to do? How do we do this? Or some of the guidelines that we had, which along with Texas DSHS and Governor Abbott and APIC and different stuff, we're all trying to do what's best. And it got to a point where we had to change a visitation, where we had to wear masks within the community and also within the hospital. We had to, anytime somebody would sneeze or cough, either here or any employer place, they were wanting them tested to make sure, because, it does spread. It did spread, and you didn't want all your employees down. So that was something that I had to kind of figure out how to do that, and luckily I had a good emergency management person that kind of had the inside on the emergency side of it, along with me doing the infection control side of it, and kind of putting our heads together of she'd get some different news than I would, and then we'd kind of collaborate to get it done and stuff.
Well, I know that you had some stubborn patients from time to time. So what was it like for you to make everybody do things they didn't want to do, speaking of stubborn patients?
It wasn't hard, I think, because everybody was so scared, and thank goodness they like me enough. So they're like, okay, fine, if we have to. But I had a good team of nurses, staff, employees, everybody that were willing to listen. Well, because they also know that I have their best interests at heart, and I want to make sure they are okay. Like I said, even though I don't work the floor, they're my patients. And then also I have some good doctors that I'd be like, this is what they're saying. What do you think? How do you think we should approach it? And they would kind of give me an okay, or let's tweak it a little bit, or, but they backed me up, whatever I felt was the right thing. Same with our administration staff.
So you were the person that we went to during that time for guidance. Who did you go to?
A lot of it was the CDC. And, it was interesting. We always used CDC before COVID as just a reference or a recommendations. But they were the ones that ended up being kind of on top of everything. And so we kind of took it more of a requirement. And we did have, of course, Texas DSHS, APIC, and CMS that kind of backed up the same thing CDC was saying. Next year, the 2021, we did have the OSHA's temporary emergency standards, along with some other stuff that came down from that related to vaccinations and everything.
Was it isolating for you during that time? Because you were kind of the person.
It was, you don't do your work thinking you're going to be on call 24/7. I mean, you are kind of, somebody has a question about bed bugs or somebody has a question about a rash or, little things like that. But when COVID started, it ended up where I'd get calls at 2, 3 in the morning, asking, hey, especially when it first started, and it's like, hey, we got a patient that's COVID positive. What do we do? They have this, that, and the other. Who do we report that to? Or so it was very tiring the first while. The other part of it was, we did COVID testing at that time, but it was testing that was routine. So it could take 24 to 48 hours at the very beginning. And so sometimes I kind of took it upon myself, and along with our lab director, that even on the weekends, I wanted to make sure that we had notified those patients of their lab results. Yeah, we had patient portal, but we hadn't utilized it enough. And so I would end up calling patients on the weekends or kind of after hours once we finally got results, just to make sure they knew so they could quarantine, so they're not going to work or take their kids to school or, all that. So it was some long hours. It was definitely trying, especially when it was supposed to only last, 2 weeks to a month. Yeah. And then we were like 3 years out. But that first year was definitely scary, and even into the second year. But we got through it. That's for sure.
Just a little off script. What was it like having a husband that was a first responder and you working in the hospital as, like I said, you don't necessarily work with patients, but you were on the front line of COVID. And then, of course, having James as a first responder. What was that like during that time, having both of you guys on the front lines of COVID?
He cheated off me.
Of course he did.
But, because, I had the knowledge, and I really wanted to make sure I knew everything. And he did his work too, but he was, as funny as he was at the time, the infection control for the fire department also, along with his other multiple titles. So he wanted to make sure that his guys were covered, and also responding out to the community, having the proper PPE or the proper masks, gowns, and then also the standards of quarantining the guys if they had it. Within the fire department, it's a little different in the matter that they live together for 24 hours. And so you want to make sure that everybody stays healthy and all that. So, he managed there and I managed here, and it was interesting, especially in a small town, to have that camaraderie, I guess. So
it kind of came to my head just thinking about you guys, coming home and comparing notes, I guess. All right, let's talk about some successes coming out of COVID. What made you proud of our hospital, our staff, or a decision that you had to make specifically?
Really, there's so many different things that we learned over the years. Some of the things that really, I think, to think about it, but one of the things like maintenance, we were trying to figure out how to have negative air rooms. And at the time, we have 1 in ICU that's permanent, 2 in med-surg that are permanent, and of course in the ER we have 2 that are permanent negative air rooms. So total, we have 3 on the floor that were negative air, and you had these patients that, they need rooms, but we don't need to spread it to that person down the hall that just had surgery or cancer or something like that. So trying to get negative air machines, and maintenance did awesome with that. And then trying to figure out how to convert rooms to it. It wasn't as hard on med-surg, but ICU, it's a brand new unit, and it's just central heat and air. So they ended up taking the windows out. We have a 6-bed ICU. They took the windows out on all 5 of them, because of course 6 is a negative air room, and set that up as negative air for that. What we didn't think about was when you have a patient that can't have visitors because they're in isolation, because the laws say, and of course having COVID, they get depressed. They don't have visitors. They don't have sunlight. They don't know day and night. And it got where we would notice that there was not as much will to live per se on some of them. And then one of the maintenance guys, we were starting to think about it, and I think even the nurses had suggested it, But one of the maintenance guys ended up removing the wood from the window and actually making a window within it, which I think that was just an awesome idea, because then you would have that sunlight coming in. They could know what's going on outside. And I mean, they feel like crap, but they can see that as daytime or nighttime and stuff. And you definitely need that in an ICU setting. Something else that dietary learned over time is when you're so sick, you can't even cut up your meat or anything like that. So they started doing chopped meat and chopped trays for them to make it easier. They had noticed that the COVID patients were losing a lot of muscle mass and weight. I mean, we had patients that lost about 20 pounds over 2 weeks just because of the respiratory problems and all that stuff. But them losing 20 pounds over a 2-week time just because of the respiratory stress and all that. And so dietary really put their heads together trying to figure out what the best nutrition would be, how high proteins, calories, all that, to be able to kind of help maintain that nutrition so that the patients could heal. The other thing that we did was we kind of separated the inpatient labs and the outpatient labs. We didn't want such a high traffic, or I didn't want such a high traffic of people coming through the hospital, especially from the community. So if we could have patients that just needed labs drawn go to a separate building altogether, that would be best, instead of coming through the hospital. So we set up an outpatient lab in a different building, and then that's something that we still have maintained this whole time. And people actually appreciate it because then they're just in and out. They don't have to wait because other people have other procedures.
And you don't have to register in the hospital. It's actually, it's really nice.
Yeah, and that is something that we did definitely keep. So,
what information would you have liked to know then that you know now?
I think just kind of some of the things I had covered already. In September of 2021, Governor Abbott finally said, enough. Every patient has to have a visitor, period. And that, none of it was our fault as a hospital or anything. We were just trying to follow what the standards were. And I know nurses, doctors, therapists, they hated that. They hated that we had to restrict visitation. I hated it because I had to be the mean guy, and when somebody's sick, you definitely want that person with them. So it was kind of a godsend that he finally made it a law, or Texas law, saying you have to have a designated person. And we found that once we did have that we started having a little more, when you have that person with you to be your advocate or just to encourage you, you have that, per se, will to live, So that's something that I wish, and I would say from here on, we always have to have somebody, with them. So another thing was, of course, like the windows and having that sunlight and stuff. I think that's very important, and I think we had already fixed our windows, changed everything back to what our new norm is. But if we had to do it again, I think we'd do the exact same thing, if not better, where we still have our HVAC unit, but have light and stuff for the patients. The last thing that I think is really important and stuff is always having one thing that the ventilators, making sure we have an extra or two. Even now, I think what really helped save a lot of these patients was that high flow heated oxygen. That was something that I think we should always keep also, just because you never know. Lord willing, we won't ever have something like this again in our lifetime. But if we do and it's a respiratory, then we have that equipment and be ready for that. So,
is there anything that we're doing now that'll help us go into the next health crisis?
I think just the practice of what we've already been through. Yeah. It's not a matter of a practice, but we've already been through it, and we know what works and we know what doesn't. And so,
a little muscle memory almost.
Pretty much. And so when you have another health crisis or something like that, we can go, okay, what did we do last time? How did we do this? Will it work this time? So I think that having practice, just like when you practice doing codes, or when you practice doing code pinks or fire drills, or you've done it, you have an idea. So if it truly happens, then you're ready.
Is there anything else that you would like everybody to know about the pandemic that we haven't covered?
I really think coming out of it, that's something else that I think we need to have better support for our employees. I know coming out of it, we started having the behavioral health program that we started doing, and we started having counselors and stuff. And I really think that coming out of something like that, you definitely need that support and the debriefing and stuff. So.
Well, you did a fantastic job. And even if you did have me telling you no every time you told me I had to get tested, and every time you told me to get tested, I was positive, and
yeah,
I still told you no every single time. So I do appreciate all you did during that time and that you're still doing. So thank you for doing this. And we appreciate all you did during that time and now.
Thank you.